Clopid, manufactured by Ferozsons Laboratories Limited, Pakistan, is an antiplatelet tablet containing Clopidogrel 75mg. Available in a 75mg potency, Clopid is specifically formulated to provide effective cardiovascular protection with proven bioequivalence. It is marketed in Clopid 75mg tablets SQs and is positioned as a reliable choice for managing cardiovascular conditions. The brand's slogan, Effective Cardiovascular Protection with Proven Bioequivalence, emphasizes its efficacy and trustworthiness. Studies of Clopid, Clopidogrel 75mg tablet, with references, bioequivalence. Study, Clopid, Clopidogrel, 75mg. Tablet has been proven bioequivalent to the reference product, Clopidogrel 75mg tablet. Bioequivalence was assessed based on primary pharmacokinetic metrics, AUC, area under the curve, and Cmax, maximum concentration. Reference, bioequivalence study of Clopidogrel, 75mg tablets conducted under FDA guidelines. Relative risk reduction in cardiovascular events. Clopidogrel, in combination with aspirin, provides a 20% relative risk reduction in cardiovascular CV death, myocardial infarction, MI, and stroke in patients at risk of cardiovascular events. Reference, study from FDA-approved data on antiplatelet therapy in cardiovascular diseases. Reduction in stroke risk after TIA, administering Clopidogrel, within 24 hours of a high-risk transient ischemic attack, TIA, or minor ischemic stroke reduces the relative risk of subsequent stroke by 30%. Reference, clinical trial data on early intervention with Clopidogrel in high-risk TIA or minor stroke patients. Efficacy in peripheral arterial disease, PAD. Clopidogrel demonstrates 24% superior effectiveness compared to aspirin in reducing major cardiovascular events in patients with PAD. Reference, Capri. Clopidogrel versus aspirin in patients at risk of ischemic events. Study. Mode of action supporting evidence. Clopidogrel irreversibly inhibits the P2Y12 ADP receptor, effectively blocking platelet aggregation and reducing clot formation. Reference, mechanistic studies on P2Y12 receptor inhibitors published in peer-reviewed pharmacology journals. Indications of Clopid. Clopidogrel 75mg. Clopidogrel 75mg is indicated for acute coronary syndrome, ACS, includes unstable angina and non-ST segment elevation, myocardial infarction, and STEMI. Peripheral arterial disease, PAD. Effective in reducing the risk of cardiovascular events in patients with PAD. Ischemic stroke, used to prevent recurrent strokes in patients with a history of ischemic stroke or TIA. Mode of action of Clopid. Clopidogrel 75mg. Clopidogrel is a P2Y12 receptor antagonist, which works by inhibiting platelet aggregation. It irreversibly blocks the ADP receptor on the surface of platelet cell membranes. This inhibition prevents platelets from clumping together, reducing the risk of thrombus, blood clot formation. The irreversible inhibition ensures long-lasting antiplatelet activity, making it effective for daily dosing. Features and benefits of Clopid. Clopidogrel 75mg. Proven bioequivalence. Clopid is bioequivalent to the reference product, ensuring similar pharmacokinetic properties and therapeutic efficacy. Risk reduction in cardiovascular events. Provides a 20% relative risk reduction in cardiovascular CV, death, myocardial infarction, MI, and stroke when used in combination with aspirin. Stroke prevention. Reduces the relative risk of subsequent stroke by 30% when administered within 24 hours after a high-risk transient ischemic attack, TIA, or minor ischemic stroke. Superiority over aspirin in PAD. Demonstrates a 24% superior efficacy in reducing major cardiovascular events compared to aspirin in patients with peripheral arterial disease, PAD. Long-term protection. Provides sustained platelet inhibition, offering long-term cardiovascular event prevention for high-risk patients. Dose of Clopid. Clopidogrel 75mg. Standard dose, Clopidogrel 75mg is typically administered once daily with or without food. Acute coronary syndrome, ACS, may be used in combination with aspirin for dual antiplatelet therapy. Peripheral arterial disease, PAD, recommended as monotherapy for reducing the risk of cardiovascular events. Ischemic stroke or TIA, prescribed for long-term prevention of recurrent strokes, particularly effective when started promptly after a high-risk TIA or minor ischemic stroke. Loading dose for ACS, if required. A higher initial dose, for example 300 mg, may be given in acute settings under physician supervision. Manufacturing details of Clopid, Clopidogrel 75 mg. Clopid 75 mg tablets, containing Clopidogrel 75 mg, are manufactured by Ferozsons Laboratories Limited, located in Raiwind, Lahore, Pakistan. This bioequivalent and effective antiplatelet therapy is formulated to manage cardiovascular diseases, including ACS, PAD, and ischemic stroke. Available in a 75 mg potency, it is marketed to healthcare providers as a proven solution for reducing the risk of major cardiovascular events. With its focus on efficacy and trust, the brand is positioned under the slogan, "Effective cardiovascular protection with proven bioequivalence."